most famous physical therapist on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about the best TMJ self-treatment to stop pain fast.
That's right, Bob.
TMJ, what is that?
Temporal mandibular joint,
Okay.
which, by the way, everyone, well, I think 99.9% of everyone has two temporal mandibular joints. They're the joint that makes your jaw open and close the way it should. But we're actually talking about temporal mandibular disorder. But everyone calls it TMJ.
Right.
Not everyone, but most people do.
I thought it was the mouth joint. So, all right, let's go to work, Brad.
Okay, so just a few simple facts about the temporal mandibular joint. First of all, the temporal area is, your temple. Right up in here, and the muscle there goes down and connects to the mandible, and that helps close the jaw.
Sure.
I'm not going to get very technical here. The mandible is the jaw itself.
Well, you're talking about this muscle right here,
Yeah.
right?
Yeah.
So you can actually, when you chew, you
Yep.
can actually feel it moving.
Mm-hmm. Exactly. And of course, there's the masseter. That's that big muscle right here. You ever see a horse? They've got humongous masseter muscle.
Do they really?
It's amazing. And we do too. They say it's one of the strongest muscles in the body compared to its size, relative to its size. And you can think of it when you're eating and chewing, it really gets a lot of workout.
And talking.
Yeah, exactly. Now, the joint that creates the pain is right here. If you feel right in front of your ear, can you show on that side?
Sure.
I'm going to mess with it's right in front of the ear hole, if you will.
Right there.
Put your finger there, open and close your
I was
jaw.
getting everybody the finger. There we go. Right there.
Why, Bob? Why? Open and close your jaw. You feel, and you can feel that bone.
That bump comes out.
Pass right there.
Yeah.
Now, the problem with this joint is it can be very painful if that joint's not functioning properly. Let's go through.
And also the muscles around it can get tense.
Yeah, when they get tight, the joint doesn't
work the way it should.
Exactly right. So let's look at this. How many people have joint pain from this? Causes problems. 6% of females, 3% of males.
That's a lot of people.
Yeah. It's a problem. There's some good news, though, coming up here. As far as the symptoms, the pain often comes with chewing. Oftentimes when you yawn, open your mouth up wide, it can lock open. That's not fun, and it's painful.
Some people get when they've been at the dentist for quite a while.
Yeah.
They had the mouth open too long.
You ever have the thing they stick in your mouth so you can't close and they're doing their work? It's not.
Yes, I did once.
Yeah, so if you got this, it's really not fun. Popping and clicking is oftentimes associated with this. However, do not get excited if your jaw pops and clicks and there's no symptoms or pain associated with it. As a matter of fact, the one gentleman I was looking at, he was a doctor in this field, and one of his relatives is concerned because he went surgery on his jaw because it pops and clicks. Yeah. And he said, do not worry about it. If it's not painful, no symptoms, it's going to be okay. So you can relax if that's your situation. The other good news is approximately, now this varies, about roughly 50% of the people that have joint pain, TMJ, it resolves by itself over time.
That would be half.
There you go. So that's good. And worst case scenario, if you do need surgery, they actually do partial replacements or full replacements, and the success rate is very good.
I've never known anybody that had surgery on the jaw. Have you?
No, I do. I know someone, she had TMJ surgery, but it was, 25 years ago or more. Really? And it turned out well.
Good.
I don't know if it was a complete, what the procedure was, but I know it turned out very good. So other things you can do if you're having TMJ pain, and it's not it's not stopping you from doing anything, it's just being an irritant. Some simple things you can do is simply learn to relax these muscles.
Right.
Because a lot of times when people get tense, and this happens with me if I'm tense, for some reason my temporalis muscles, they tighten up. So does my
Yeah.
jaw. And it's
Just
just
that
natural.
throbbing vein.
Exactly. So learn to relax. You need to practice that. Think about breathing. And as you breathe and exhale, think about those muscles turn into soft butter on a hot summer day on a picnic
There you
table
go.
with sun beating
Nothing
on it.
better.
Good posture is critical, Bob.
People find that unusual, that the fact that posture will affect the way the way your jaw is seated in your skull.
Exactly. Yeah, that the joint oftentimes will not work properly with head forward posture.
You can tell this when you try to eat.
Mm-hmm.
And if you eat with poor posture, it's hard. If you can't swallow very
Right.
well.
Sometimes the chewing, the clicking may get worse.
Yeah.
It's like the shoulder joint. If you have poor posture, the shoulder joint is exactly the same way. It doesn't function well.
Really important.
Yeah. So head up, chin in, get that good tall posture, and think about that. We just did a video on posture.
Yep.
That would be a good one.
Check it out.
Absolutely. And then stress reduction.
No, you
exercise.
forgot sleeping supine, Brad.
Yeah, well,
Sleeping on
I
your
switched
back.
those around in my head.
Oh, you did?
'Cause
Okay,
I have
sorry.
them memorized.
Got it.
Yeah, sleeping on your back is best.
Yeah, as opposed to your side or your stomach.
Right. Because if you're on your side, especially if you put your hand up there, you relax when you're sleeping, then your jaw can be
Right.
pushed out of where it needs to be and cause a problem when you wake up and then have symptoms.
As much as you can. sleep on
Exactly.
your back.
Okay. Stress reduction, go for a walk, do some yoga, some meditation, things to be relaxed.
Always good in walking in nature.
Yes. Yep. Let things flow out. Now, all those things seem like a lot of things to do, but this is the core of it.
Sure.
Is these exercises. Bob is going to show on his side without the mic.
Well, I was going to just show it, yeah.
Yeah. So you can do this on both sides. Now,
At the same time.
I can't do it here because you're going to hear that noise. It's real irritating. The first exercise, these only take a minute or two, is your fingertips upward and downward, pushing in deep into the masseter, that muscle. Yeah, get right in there, Bob. Go up. Yeah. Pushing up. You feel that, Bob?
Yes.
You feel that muscle relaxing?
Absolutely.
It is. It's amazing. I'm going to do it on this side because it does feel good. You can do that for 30 seconds, okay? And then go up to your temporalis muscle right behind your eye. Do the same thing in there. Push in.
Oh, that feels good.
Yeah. You see the wrinkles on the skin. You're pushing up the skin. That's what you want to feel and see. Do that for 30 seconds. Now we're going to go back to the masseter. Start at the top of it, deep down, and pull down on that muscle. Just go the opposite direction.
Boy, you don't realize that you probably have some stress in there until you do this.
Yeah. Yeah, because you didn't feel stressed
No, I
before,
didn't.
but you realized there was stress in
Yep.
there. Yeah. You can see, it looks like you're ready to fall asleep, Bob. Go up to the top,
Feels so good.
the temporalis. Oh, wow. I can feel, I think I got a trigger point in there, Bob.
My temporalis is more than my masseter. You're right. There's quite often trigger points right on that muscle.
And it is getting better as I do this. Now we're going to use our knuckles and use a different method. We're going to get in there on that masseter joint. Now with this, the jaw's gently closed.
Sure.
Don't tighten it, just so your teeth are touching.
What do we do? Circles?
Circles, yeah. Work around, go both directions. Make sure you go up to the temporalis muscle. Do the
Temporalis.
same thing.
Again, that's the one that feels good for me.
Now I find if I use these knuckles as opposed to these,
Right.
the
Well,
first,
I'm not sure which ones. Yeah, the MCPs or which
yeah,
one?
that's the OT thing. But
Yeah.
you do whatever feels good. Work it more towards the fingertips or more towards the second joint.
Whatever knuckle works.
Yeah, there you go. Now open up. Yeah, Bob, I'll talk. Bob's going to do it with his jaw open and just repeat the same process. 30 seconds down above. And, you don't have to go exactly 30 seconds.
Quite a sight, huh?
You're doing good, Bob. You're going to take a nap after this. Very good.
Oh, the left side of my head is all relaxed.
Yeah, so now make sure you do both sides so you stay symmetrical and you don't have a smile that goes like this. So very good. Good luck with that. I'm 99% certain you're going to feel some relief, and probably
Right.
we had so many positive comments on
Right.
this.
People are surprised at
Yeah.
how tight those muscles have become. You might be having trouble with the joint, but the muscles around it can cause that pain.
Right. Oh, what about? Do we have a
Oh
giveaway?
yeah, we have a giveaway.
Oh,
No, it's Saturday.
oh, it's Saturday.
Yeah, we always do the giveaway,
Yeah.
but check it out tomorrow. Go to Facebook, and it'll be pinned to the top of the page.
Right.
The contest.
Absolutely.
And check out our podcast.
Yeah, the podcast. We got that surgeon coming up talking about back surgery. That's
Yeah,
going to be up in a couple
non-invasive.
weeks, right?
OLLIF is the type of surgery.
Oh, yeah, that's
They go
the
between the muscles. They don't cut muscles.
with the Oh no, the
No,
ultrasound.
This is not. No, this is actually surgery.
Don't tell them. Keep
Okay.
it a secret.
Keep it
All right.
in suspense. All right.
Take care.
Take care.